Welcome everyone to the Vital Sites webinar, People and Parks, the Pathways for Social and Ecological Recovery. And happy World Habitat Day to you all. My name is Karen Keenly-Side. I am joining you today from Chelsea, Quebec in the Gatineau Hills, just north of Ottawa, Canada. And I would like to acknowledge that this is unceded territory of the Algonquin people. I am the thematic vice chair for People and Parks with the IUCN World Commission on Protected Areas, the WCPA. And I am co-chair of IUCN's Nature for All initiative. My day job is with Parks Canada. You can learn more about WCPA and Nature for All at the links in the chat. A really important part of WCPA's work on people and parks is that of its health and well-being specialist group, which is led by Joe Hopkins at Parks Victoria in Australia. And that work is central to our webinar today. More than ever, as the COVID-19 pandemic continues to unfold, people are recognizing the value of nature for our physical and mental health and well-being. And this begs the question, how can we ensure that a renewed relationship between people and nature leads to positive outcomes for both? We have a great session for you today to explore that question. And I'd like to quickly introduce our panelists. Claire Shine, Gil Penalosa, Shauna Jones, Mark Camley, Carol Ritchie, and Mariana Napolitano Ferreira. Our session managers are Joe Hopkins, Pascal Vanderleest, and Lydia Sims. Thank you so much to all of you. I would also like to note that the development of this webinar has been very much a team effort, as you can see by the number of session partners listed here. Thanks to all the partners involved. Before we get started, I just want to review a few tips for those of you who may be new to Zoom or who need a refresher. Everyone has been muted to help ensure clear sound for you all. You can mute or unmute using the microphone button, but we ask that you please remain muted for the time being. You can also turn your camera on or off using the video camera icon at the bottom of your screen. To facilitate conversation, please confirm that your name is showing correctly. You can do so by selecting participants at the bottom of the screen and then clicking the rename button by your name or number. You can also add your organization and preferred gender pronoun after your name here. I'd really like to point out the chat function to you. Please pay attention to the chat box, where we will be sharing additional information during the event. I also invite you to pose questions for panelists here, and we will draw on those questions for the question and answer period later in the session. I hope you enjoy our webinar today as we explore how we can build support for parks and protected areas, for nature more broadly, as part of our pandemic recovery. Our panelists will examine a variety of topics, from policy to practice, related to how parks and protected areas can assist with our pandemic recovery and what this can look like on the ground as tangible programs and practices. I think it's a really exciting event. And here's our agenda. The agenda will also be posted in the chat so that you can keep track. Today's session will be 90 minutes long. We'll begin with 5 short presentations of 10 minutes each. And to keep us on track, I'll be reminding the panelists when they have about 2 minutes left in their presentations. At that point, you'll hear a sound like this. It's the call of the loon, of course, one of my favorite sounds. At that point, our speakers will know that they have about 2 minutes to wrap up their presentations. Following the presentations, we'll have a facilitated discussion with the panelists. Again, I ask that you please share your questions in the chat box for that discussion. Now, it's my pleasure to welcome Claire Shine, Vice President and Chief Program Officer with Salzburg Global Seminar. Her biography will be posted in the chat box, and we'll be doing this for all of our panelists. Claire is going to provide us with an overview of the impact of the global pandemic on the parks and people interface, and give us a sense of what key steps are needed to ensure that both people and parks flourish and thrive. Take it away, Claire.
So I've got a provocative title, Never Waste a Good Crisis. And the real question is, how can we use this moment that is gripping the whole planet to move minds and resources for people and parks? First of all, COVID is a threat multiplier. The people who are already most vulnerable through poverty, through poor housing, through poor education, through a lack or very poor quality of healthcare, have suffered the most, and that is not yet finished. And so this crisis forces us to look squarely at the roots and the consequences of inequity, and to think of those in the light of going forward with the Sustainable Development Goals. But lockdown has also forced us to think in a very human and community-oriented way of what is being lost or what is now being put at risk. All of us know, wherever we are in the world, about the compound effects of isolation, how we are terrified, rightly, of what is happening to the mental health of each generation, seen or unseen, and the ticking time bombs that are being stored up there. And arguably, it's possible to say that perhaps the oldest and the youngest in our societies are some of the most impacted by the fact that community cannot operate with the normal support structures in the way that we would like. So with a recovery, there are always trade-offs. We're seeing, for example, that the moment people could get outside, they rushed to the open spaces. And that in itself became politicized, it became weaponized, and even an instrument of division in society, because people who had access to the countryside and to gardens, in some cases, reacted quite forcibly around this crowding, in this case, a picture of Snowdonia, a mountain in Wales. But more deeper trade-offs that we have to be very alert to as a parks community is that unemployment globally is set to rise very sharply. And all of us here know how sectors such as environment, culture, and early childhood are often those that are first squeezed when it comes to budget pressures around the cabinet table. We know that urban parks can deliver so many win-wins for healthy societies in terms of, for all generations, sport, outside activity, community, but also for the creative and local economy, whether the cultural economy, cultural innovation, new tourism resources, as here we see with the Culture Park in Korea. So a question really now is how strategically and in terms of cross-sector policies, the narrative can be shifted to really keep a focus and a political pressure up for investment in parks and the recalibration of urban societies and urban economies. And that is an extraordinary opportunity right now, because we know that the world of work, the way we live together will change, and that will affect all sectors of policymaking, of investments, and of return on those investments. So looking forward, and for my final comments, equity, which I touched on at the very beginning, has to be understood as being at the very center of the pivot for nature and health. I have a couple of images from different parts of the world. This one comes from Mumbai, and where we see that the poor have so much less access to green space. Many of you are already very familiar with this. So the picture I have on my screen is a picture of South Africa, which was entitled Green Apartheid, showing that the correlation of politics of spatial injustice, racial injustice, economic injustice, create a layer cake, in effect, that impacts very directly on the whole issue of parks for people, parks for health, and the very viability of healthy societies. This slide, I hope you're seeing it, is a view from space of a poorer and richer part of Oakland, and you see so directly where the trees are to be found. So finishing off and hoping that the PowerPoint takes me to the end, I've written of a call to action and an opportunity for bold leadership, which goes way beyond the sectors that most of us deal with in our daily capacity. Because of the seismic struggle that we are facing with our balance sheets, public and private sector, the need to think smart about where we can get a greater return on investment will never have been greater. And arguments such as mental health, resilience of the workforce, readiness of the workforce to go back into what we thought of as conventional patterns of working. Nature is not incidental to those arguments. The feeling of safety, the feeling of community, the readiness to take new risks to restore a way of working and coming together will hinge on the way that we make those cities viable and welcoming once again and change the equation. A final slide, which I like. This is from the Aga Khan Development Network, which has invested hugely in urban parks in major megacities, often areas with great spiritual and cultural significance. And the fate of the poorest and the cohesion of all cities will depend on vision across the private sector, the financial sector, and all sectors of government in terms of turning the tide post-pandemic to build forward better. So I will stop there, and I do apologize again for the clunkiness on the side of the PowerPoints. Karen, over to you again.
Thank you so much, Claire, and no apologies necessary. I think you've given us some amazing food for thought and really set the stage for the rest of the conversation. You mentioned equity as a key theme, and our next speaker is going to dig into that a little bit more. So with the context that Claire has provided, I'd now like to welcome Gil Penalosa, Ambassador for World Urban Parks, founder of 880 Cities. He's going to share with us a bit of a deeper dive into some of the issues surrounding equity and looking after vulnerable populations. You see, Claire is incredibly eloquent and had no issue speaking. I stumble over my words, but I don't have a PowerPoint to deal with.
Well, I stumble over my PowerPoint. So.
Claire to Gil. Gil Penalosa, everybody. Thank you, Gil.
Thank you very much. Half of the homes that will be around in the world in 40 years, half of the homes do not exist today. Today we have about 3.5 billion people living in cities. Within the lifetime of our children, we're gonna go to 7 billion. And it could be very nice. We need to decide, how do we want to live? We could have mobility for people to walk and bike and take public transit. We could have people of all ages and backgrounds, races, ethnicities, enjoying parks and nature. We have a wonderful opportunity, because imagine we have kind of like a magic wand that in the next 40 years, we're gonna build as many homes as we've done in the history of humanity. But we also have a huge responsibility, because whatever we do or don't do is how people are gonna live for hundreds and hundreds of years. So if that's gonna happen in the next 40, let's see what we've been doing in the last 40. Unfortunately, the way we've been doing cities is overwhelmingly horrible. We've been segregating, we've been not integrating, we've been doing cities without parks. Even the wealthiest city in the world, the wealthiest country in the world, the US, you see cities by postal code. Some postal codes, the life expectancy is 60. 10 minutes away, the life expectancy is 90. We've been focusing on cars and not on people's happiness. And this is the kind of cities that we've been building. Even trying to solve mobility, investing billions, we haven't even solved mobility. The cities do not decide the what. The population is at the national level, but the cities do decide the how. And this is how we've been building cities. There are no trees, there are no parks. Actually, instead of parks, we've been doing parking lots for cars. So imagine the children, the elderly, the people with disabilities. They need someone even to have a car to take them out for an ice cream. So the last 40 years have not been good from the point of view of creating cities. So we need to improve the cities that we have today. We gotta create new cities for many, many people, but we need to do it radically different. Radically different. We must change. It doesn't matter if the cities are 2,000 or 500,000 or 5 or 10 or 20 million people. The issues are the same. The solutions are different. All of us are having public health crisis. We got equity crisis. We got population growth. We're living longer everywhere. And we got climate change. And we see the symptoms everywhere, even if some people still don't want to believe in it. In the cities, this is Chicago, in the dense area that is the blue, has a lot less impact. So density has to be part of the solution. Ideally, as we double the population living in cities, ideally should all be in the existing footprint. And when we think of climate change and this overwhelming issue, COVID arrived, COVID-19, some people say all change. I think that more than all change is the perception change. Now we have some magnifying glasses to see much reality. Equity, we see people homeless that are put to sleep on parking lots when 90% of the hotel beds are empty. But on the positive side, we see the quality of air, how much it has improved thanks to the fact that there are fewer cars moving. So what are we going to do in the future? We have an opportunity of having a healthier, equitable, more sustainable. And when I'm talking about health, I'm talking about it's a state of complete physical, mental, and social well-being. It's not just the absence of disease. And when I'm talking about sustainability, I'm talking about sustainable happiness, which is the happiness that contributes to the individual, to the community, to the global well-being, as long as it does not exploit other people, the environment, or future generations. So we have a great opportunity and great responsibility. Some people think it's going to be easy, like this one runs on money and makes you fat. This one runs on fat and saves you money. But it's not, and we're going to do parks and trees, but it's not going to be that easy because there are many other people that are thinking of a future more isolated, more car dependent, less community based. So we need to act. We need to develop a vision, but we need to act because the future might be worse if we don't act. So how do we want to live? How do we want cities to become? I think we need to kind of like a jump over COVID-19 and change the way of doing things. If we want cities that are equitable and sustainable, if we want people that live healthier and happier. So I want to take you through 4 messages in the next 4 minutes. One is parks for all people. What are great parks? Great parks are great if people visit, they stay and they return. It's not if they win awards. People say small or large parks. We gotta have all of them. We gotta have a citywide park system with small, with large, with active recreation, passive, contemplative. Every person should have a park within a short walk. Everyone. It seems so obvious, but nevertheless, even in the US, 100 million people do not have a park within walking distance. That's 1 out of 3 people living in cities in the wealthiest country. So I want to invite you to the campaign 10, 20, 30. What is the 10, 20, 30? Is everybody must have a park within 10 minutes or by a walk by 2030. By 2030. It has to be now. And it's doable. We gotta start building parks all over. And if we don't have a park, let's think what's public, the streets, the schools, the libraries, the community centers. Let's turn like some schools pavement, they call playground, into parks with lots of green, because when they play in green, their attention deficit and hyperactivity disorder is lower. And if we don't have a school, let's take a street. The streets are the biggest public space in the city. I mean, one of the big problems of parks is management, because people think that it's maintenance. No, it's not the same. Of course, we gotta pick up the garbage and cut the grass, but it's about the uses and the activities. Having grandparents and grandchildren doing bread. It's about people walking and cycling and playing chess. It's about having volunteers. It's about having all kinds of uses, linear parks, small parks, big ones. It's about having connectivity. Let's keep in mind, empty parks have fewer benefits. So we gotta have those activities for people of all ages and all interests and all abilities, whether it is farmers market or flower gardens or laughing yoga. It can be many different things. And we gotta think of all ages. We gotta think especially the 0 to 4-year-olds, because the 0 to 4, that's when the brain forms, that's when people develop a lot of the physical and mental benefits that they're gonna have for life. So we gotta have all of those for 0 to 4, for 5 to 12, for 12, and of course for older adults as well. Parks and uses and activities. Great parks also are not for the summer, it's for 52 weeks of the year. And we gotta think of sidewalks because the sidewalks are kind of parks. The sidewalks are the most important infrastructure. That's how we get to the park. We use them in the summer, we use them in the winter, catch Pokemons, we catch public transit, but then in the parks, we meet the neighbors, people meet boyfriends and girlfriends, we develop a sense of belonging. We gotta have trees all over the sidewalks. The sidewalks remind us that walking is much more than walking. And sidewalks are part of the family of parks. Second, we gotta have nature everywhere. And nature everywhere, why? Not only because it looks beautiful, but because with nature everywhere, it's going to improve the culture, the education, the recreation, the health, the well-being, the economic development. We got to change we got to have healthier lifestyles. We got to have farmers markets everywhere. We got to have urban gardening. So children and adults and everybody will learn tomatoes don't come out of factories. There's no health without mental health. So we got to focus. The depression is the world leading cause of disability. If we have contact with nature, it's going to improve our mood, our cognitive attention. So we need to have nature and use it whether we're in Puerto Rico or we're in Alaska, anywhere we are, in all climates and all weathers. We gotta have green neighborhoods because green neighborhoods lower the depression, the anxiety, the stress. That's why nature everywhere is nature at home, on the sidewalk, on the school, on the place of work, everywhere. We gotta have, it's like a call to action of nature for all, call to action also of national parks, national park cities. The third message is let's focus on the vulnerable people. Our most vulnerable citizens are the children and elderly by age, but also everyone, all people that are poor, that have disabilities, racial minorities, ethnic minorities, women in many places. So we need to focus. Everything we do, the umbrella has to be vulnerable people. For like children and older adults, imagine cities that are playable so that the children are having fun and children are close to nature. And that is something that is really critical and very important because for children, playing is fun and games, but also is how children learn, is how children develop their muscle strength and their coordination and the sense of belonging. So we gotta have nature and playability everywhere. This is gonna be the future city builders and we're living longer, much longer. So the older adults are critical. You know, people are having fun doing gardening and eating ice cream and playing with their grandchildren, and the population over 60 around the world is gonna double. The population over 80 is gonna quadruple. And parks and the uses and activities for older people are critical in order to be happy. Walking is one of the things that people do. So every single park should have walking paths, whether it's large parks or medium ones, or even small ones, the size of a basketball court. And of course, we gotta work on the multi-generational grandparents, grandchildren, because this is also critical for the happiness and the benefit of families and the benefits and the happiness for everyone. And the last message, obvious, we gotta change. We need to change. If we want cities that are equitable and sustainable, and if we want people that are healthier and happier. Why don't we change? Because change is hard. Doing more of the same is easy, but change, let's keep in mind, is not unanimous. The general interest must prevail over the particular interest. And the cost of doing nothing is not nothing. We got climate change, so we got to work on this. These are not technical issues. These are not financial. This is about policy, but not about political parties. Policy, everybody should be on board with a big P. Everybody needs to participate. Let's be bold. Let's build broad alliances in schools, faith groups, parks, libraries. Let's develop that sense of urgency. COVID arrived and all changed, but it's an opportunity. When there are fewer cars, all of a sudden we see people all around the world creating networks of protected bikeways. So what people said it couldn't be done, actually it can be done. When we don't have parks, then all of a sudden people are taking over the streets and making it for people to walk and bike, whether it's Auckland, New Zealand, or Oakland, California, where they created 115 kilometers in 24 hours, creating bus lanes. There are not enough parks, so people are taking over the streets. And this is a fantastic possibility, turning golf courses that at maximum 300 people use in one day to public parks where thousands and thousands can use those. So it's about equity. The impossible all of a sudden became possible. and we are happy. But for being happy, let's calm down because we got much, much more to do. We need to develop a shared vision and lots and lots and lots of action. And with a shared vision and lots of action, we're gonna be able to move from talking to doing. So I invite you, everyone, let's do it now. Thank you.
Thank you, Gil. Fantastic presentation as always, and thanks for reminding us about the importance of nature in cities, in this relationship between people and nature. We're not just talking about wild places remote from human development in strengthening this relationship as we look at recovery from COVID-19, but what happens in cities is absolutely fundamental. I'd like to remind everyone that we'll be having a discussion session after all the presentations, but if you do have questions now, please post them in the chat. Pascal and others are busily collecting those questions as we go, and we'll try to pull some together for our discussion session at the end. You can, of course, wait till the end, but feel free to post them in the chat now. I'd like to move on now and introduce Shauna Jones. She's the Senior Manager of Health and Community Activation at Parks Victoria, and she's going to speak on the vital role of parks and nature in supporting health and well-being. Take it away, Shauna.
Hello, everybody. Thank you very much. My turn for a couple of technical glitches. And that is a tough act to follow. Gil, thank you so much for, and Carol too, Claire too, for the fantastic context and the enthusiastic messaging. I hope to be able to provide a bit of perhaps more local context. I am an expat American living in Australia. I've been here for about 40 years, and I've got the pleasure now of working with Parks Victoria. Many of you may know that Parks Victoria was probably one of the original authors of the Healthy Parks, Healthy People concepts and approach. So some of the slides will concur and reinforce what we've been hearing now from both Claire and from Gil. Some of the things I just want to briefly run through, which will be familiar territory for many of you, with some research and evidence that we've been framing our work with, some of the policies, programs, and partnerships that we in Victoria, Australia, rely on in terms of the context and the enabling factors that allow us to do our work. And lastly, a bit of a drum roll where we'll be launching our newly minted Healthy Parks, Healthy People framework for the next several years. It would be remiss of me, as per Karen's opening remarks as well, to acknowledge that I'm standing on the lands and presenting to you from the lands of the Wurundjeri people, the traditional owners of the land of part of the Kulin Nation here in Victoria. And it's an interesting reflection back over millennia that, you know, perhaps this is the origin of Healthy Parks, Healthy People in some ways. You know, if we understand the messaging of if you care for your country will care for you. So I would just like to acknowledge elders past, present, and emerging. This is quite meaningful for me as I am from an ancestral lineage of the Cherokee Nation, so I just would like to acknowledge that as well. From there, of course, we take a giant leap forward or so into, you know, our father of modern medicine, known Hippocrates, who is quoted and attributed as having said, "Nature itself is the best medicine." And there were also some tenets that came forward into the Hippocratic Oath that says, you know, physician first, do no harm. So when we come to a later slide, when we look at some of the social prescribing practices going on around the world and referring into parks, the one thing we know is that there are likely to be no unintended side effects from those referrals. This looks a bit like some of your photos, Gil. I think this is Australia. Sadly, we have an urban design policy of sprawl as well, like many other places around the world. Ironically, Melbourne has been, along with Vancouver, we sort of go back and forth, and some cities in Europe, about being amongst the most livable cities in the world, and that depends on which classification and marking system you look at, but we certainly are privileged to live in a reasonably livable city, although we're projected to have roughly 10 million people in Melbourne, up from about 5.5 by 2050. So that's an interesting trajectory that we'll need to have some careful planning along the Healthy Cities principles we've heard about already. These consequences of this sort of living, Gil has covered beautifully. Unfortunately, most of them, whether they are disease or dis-ease, we find that they've probably been exacerbated, as Carol pointed out, from the COVID, the entry of COVID and other conditions. In Australia, we're still recovering from last summer's catastrophic bushfires. And off the back of that, we entered COVID. And I think, you know, our cousins in parts of the US and other parts of the world, you know, now in a disastrous bushfire scenario as well. So the climate change issues and the environmental degradation is certainly also, you know, the exacerbation of some of these issues. So certainly we have seen with social isolation, we're experiencing probably one of the most severe lockdowns in Melbourne, Australia. We are still in lockdown and have been you know, restricted to a 5-kilometer movement limit. So I'll come back to that in a minute. But you know, the social isolation, people experiencing the increased reporting of mental health, anxiety and depression, you know, the screen time certainly for all of us, I think around this table, has increased, you know, 1,000-fold. So certainly the indoor lifestyle and the sedentary behavior has certainly gone up. And I think that just really quickly here, lots of words on this slide, I apologize, but really what it's meant to address is some of the, you know, over recent times, some of the work that's been looked at here in Australia and abroad regarding the costs of healthcare, which we know most of our modern healthcare systems have been struggling under the stress of dealing with COVID specifically. We've also noted that lots of people aren't being checked and receiving health services for their pre-existing and other health concerns in this COVID period. So it's a double-edged sword there. But one of our major health insurance providers, Medibank Private, back in about 10 years ago, estimated the costs of mental health, ill health, being estimated then at roughly $200 billion annually. So again, 10 years on, I don't have a current figure, but that will be an interesting one to compare over time. Our own work in Parks Victoria has shown that with roughly a 10% increase since 2007 to the number of annual visits to park for physical exercise, we found in our Valuing Victoria's report that avoided healthcare costs and productivity impacts associated with undertaking physical activity and recreation regularly in our parks could be worth up to $200 million per annum in offset costs. Recently, and some of you may be aware of some of the work the really preliminary work coming out of Griffith University in Brisbane, Australia, by Bruff, Buckley et al., trying to look at a unique way of analyzing the value of parks and green space in terms of mental health and well-being, and using the quality adjusted life year method, which is common along with the disability adjusted life year indicator in the health sector. But some of the preliminary results, and they did have a look at some of our parks in Victoria, and they actually basically estimated, and this figure is quite staggering really, for in Victoria alone, that parks and green space impacting positive mental health and well-being could be worth roughly $25 billion annually through contributions to population mental health. I'll leave that thought with you. More research is needed, as we all like to say, and we understand this to be the case. So there'll be more work to tickle out some of these findings and to unpack the use of the quality adjusted life year method. I guess more recently then, and Gil and Claire both have referred to this, but in the US, it appears, and we've experienced this as well, roughly 83% of US adults agree that visiting their local parks, trails, and open spaces have been essential to their mental and physical well-being during the COVID period. Some of those, the picture in Scotland, Claire, that looked like our 1,000 steps on a weekend when we had 3 weeks to open up and get out into nature prior to the second wave and the second lockdown. And really we had 10,000 people trying to get up a very small space, no social distancing allowed, safety compromised, neighbors concerned, et cetera, et cetera. So it is a problem, I think, that we're probably all seeing. Now, in 2015, Parks Victoria commissioned its first review of the literature in the state of the evidence for healthy parks, healthy people, and the value of nature and health and well-being. Early on, so this is, well, roughly, this is 5 years ago, so it's not so long ago, but since that time, we've seen a plethora of daily research coming along. So I won't go through all of these. I think hopefully you can see some of these results from across the literature in terms of decrease in blood pressure, decrease in stress hormones, particularly cortisol, spending roughly 20 minutes at a minimum in parks and nature, decreasing anxiety and depression and so on. But the empirical evidence is really showing the relationship between nature and health, and this is a really pleasing trajectory. Quickly, and again, this won't be new news for most of you, but certainly, as Gil alluded to, the definition of health being the complete, not just the absence of disease, but complete and holistic physical, mental, and social and cultural health and well-being. We have focused largely in Parks Victoria on the prevention side, the positive health and well-being of spending time in nature and those benefits, whether you are motivated to go to parks and nature environments because of, for the benefits, or whether you actually just receive them incidentally by being present. But we're moving towards, trying to move down the continuum of managing risk and restorative and rehabilitative purposes of health and well-being. Gil mentioned too a lot of the cross-sector work that is going to be necessary both now and in the future. Certainly coming from a health promotion background, the multidisciplinary and cross-sector agenda in terms of the social determinants of health and how all sectors, healthy public policy across all sectors is going to really be significant or increasingly significant as we go forward. So we're really privileged here in Victoria because we have a strong policy context that we operate underneath from Parks Victoria. We have the third iteration of our Victorian Public Health and Wellbeing Plan, which are 4-year plans. This sits under a piece of legislation, which is the Public Health and Wellbeing Act, and requires the state government to produce a 4-year plan for implementation. This also extends to our local government authorities, who are actually charged with having a 4-year local authority and municipality level health and well-being plan. And this really cuts across the built environment, the social environment, the economic environment, and the natural environment in terms of planning context. Going around the slide there, we have our environment, biodiversity 2037, protecting Victoria's environment policy. This comes from one of our other environment agencies that we work closely with, the Department of Environment, Land, Water and Planning. We have the Sport and Recreation Victoria, Active Victoria Plan, and we have our Corin Ballot Jack Aboriginal Health and Wellbeing Strategy. So I guess, to reiterate some of what has been said already, advocacy with a call to action, capital A advocacy, where possible, continue to innovate, and by that I mean try something new, change, as it's been stated, and to try new initiatives, new ways of thinking. Don't stick with something if it's not working. Be active, go in sprint cycles, whatever you like to call it. In 2017, we were able to sign at the World Public Health Congress that was held in Melbourne, a Victorian Memorandum for Health and Nature. This, it was co-signed by our health minister as well as our environment minister. So this has given us a fantastic platform to work across sectors for the past several years, and it's going from strength to strength. Finally, I guess it definitely is my privilege, and I have to say, in all my 45 years of working in the health sector, having healthy parks, healthy people in my title is one of my career highlights. So it's a privilege to be able to launch onto the more global stage Parks Victoria's newly minted Healthy Parks, Healthy People framework. And again, I won't belabor all of this because I will put the link in the chat, and we will be you'll be able to access this from our website. But basically, reiterating previous comments as well, healthy places and settings for everyone, all abilities, all cultural backgrounds, all age group cohorts, the lot. We are really trying to focus particularly on underrepresented groups and people who maybe haven't previously had the opportunity to realize local visit to parks. And one of the things I think was notable in during our COVID restrictions with this 5-kilometer radius I spoke about, it became quickly apparent that in our outer suburbs of Melbourne, people did not have green space or a park within a 5-kilometer radius to get to. And we had to modify those restrictions to allow people to drive to a green space for their 1 hour of exercise per day. Quite an interesting phenomenon. So basically, our strategic priorities are on your screen there under our Healthy Parks, Healthy People framework. And in particular, it's been mentioned too that the workplace will change. It is changing, it has changed. And certainly those workplaces that can take account of providing or being located nearby or promoting the use of green space for their employees everyone will reap those benefits. Nearly there. Certainly our target populations I've mentioned, as have the others. So certainly urban and regional populations that in Australia and in Victoria have higher levels of physical inactivity. And surprisingly, a lot of our national and state and regional parks that exist in our regional areas are mostly visited by Melburnians who are escaping, the urban environment. So it's an interesting one that we want to be able to improve access to those environments that are right in people's backyards, so to speak. Focusing on children and youth, certainly a priority for Parks Victoria at the moment in terms of youth. Sorry, going back. Apologies. And really, we have to do this largely through families. Our Junior Ranger program is a highly successful educational program taking place on school holidays, and that obviously targets young children in primary school age. But beyond that, we really are trying to encourage families to be more active in nature together. And certainly during COVID, we have seen an increase in family-oriented behavior and uses of neighborhood environments. Seniors and all abilities, I'm very keen to keep this live on the agenda, not only for personal interest, but obviously, as Gil has pointed out, we have a doubling and quadrupling of our older citizens who we want to see remain healthy and active through the course of their life. And we started with the notion of our traditional owners, and we have much to learn from our traditional owners in terms of connection to country and the cultural and physical mental well-being through that connection to country. It is also interesting to note too that some of our younger Aboriginal members of community are amongst those who are disconnected from their cultural roots to a certain extent. So there's value in reconnecting across all of our communities. This I won't go into. This is a schematic that you'll see when you look through our Healthy Parks, Healthy People framework.
We really need to wrap up. We've gone past time.
This is the last slide. Thank you, Karen. And this you can see in the framework. So that down at the bottom of that slide is the link to the website. And to finish off, those are some of our partners. We could not do any of what we do without our partners. Again, you'll have access to this slide, but you can see that across mental health, our lead peak body for people living with autism, Heart Foundation, primary health networks, etc., that these are our partners across multiple sectors that help us to deliver our community programs. And the very last slide will show you something that's happening right now in Victoria. For the first time, all of our environmental partners through the Victorian Environment Forum are engaged in delivering what has been forced to be an online Victoria Nature Festival. So I encourage you to visit this, the website is there. I encourage you to visit that if you are interested. This started out as a face-to-face, of course, but pivoted to being an online offer in this current environment. So thank you very much, and apologies if I've gone a little bit over.
Thank you,
Thank you very much,
Shauna.
everybody.
Thank you so much. And congratulations to Parks Victoria, as always, for being an incredible leader in this field. Apologies for interrupting. I've heard that my beautiful loon call isn't audible, so you had to have my voice instead. So we're going to move on now. I'd like to introduce Mark Hamley. He is the Executive Director of Parks and Venues with the London Legacy Development Corporation in the UK. And he's also chair of the Advocacy Committee, and we've been hearing about advocacy with World Urban Parks. I'm very pleased to have Mark here to share his passion for parks, as well as new research on the changing use of parks. So welcome, Mark.
Okay, thank you. I've been asked to go quickly, so I will, although I've got a Scottish accent, so it might be too quickly for some. So we're going to go from the macro to the micro, and I'm going to talk specifically about Queen Elizabeth Olympic Park in London and use it as a case study for some of the research we've been doing, particularly around COVID. So the park itself came out the 2012 Games, and part of the promise was to change for a whole generation of East Londoners this part of London. It was one of the most deprived areas within London. This is a map of London in 2007. Yellow is where the park is, and green is the most deprived areas. It'd been the same for over 100 years. You could have drawn this map 100 years earlier and it'd have looked exactly the same. So what was taking was an area with mixed industrial and heavy vehicle usage, polluted waterways, overhead pylons. Soil remediation went on through millions of tons through a program of cleaning down to a human health layer of 600 millimeters. And the toxic waste and heavy metals and asbestos that littered the site was taken away. And new landscapes were formed and the creation of a floodplain to protect 5,000 homes further south down the valley. The Games of 2012 were a huge highlight and everything was planned round 2 weeks in August 2012 with a big focus on the planting being available at that time, which obviously was great for that moment, but doesn't give much variety around the rest of the year. So I joined in 2012 to redesign part of the park and get it reopened. And it opened in two parts. The southern part of the park opened in April 2014, and the northern part of the park opened in July 2013. And one of the things we wanted to do was to focus on ensuring that it was a park for local people. It was aimed for being for international visitors for the Games, and also because we've got the London Stadium, the former Olympic Stadium. We've got the Zaha Hadid Aquatic Centre and so on, and the Velodrome. So it was aimed for national and international visitors, but we're really interested in making sure that we serve the local people of East London. And these two maps show the members of the Aquatic Centre and the Copper Box Arena, which is our main gym, that actually how close these people live in to the park itself, and so that we're serving the right people. We collect regular visitor information, as most parks do, but actually a number of things we were concerned about. One of those was that we had a very high proportion of A, B and C1 in social economic group, i.e. we were hitting the rich people rather than the poorer people within the boroughs. And secondly, we had a lower level of diversity for Black, Asian and minority ethnic groups. And that's been a challenge for us to look at that and try and improve it over the years that we've been open. And we have slowly made a difference in terms of that proportion of Black, Asian and minority ethnic groups coming to the park. but it's a continuing challenge to make sure that we're being equitable with the space that we have been allowed to take forward and manage. I'm not going to major on this one, but we obviously collect information on people, why people visit the park and what their experience is. And we are very proud of having a net promoter score of 79 when 50 is considered to be excellent. So our aim is to create a place for all and ensure that everyone can come and enjoy a place in East London in a park that never existed 10 years ago. But then we had COVID, and this chart, which shows Bank of England forecasts of the impact, shows that actually the economic impact of COVID for the UK is the worst it's been economically for 300 years. So we collected quite a lot of data. So first of all, in terms of our people, we lost one member of staff to COVID early on during the crisis. And we also lost one of our volunteers, unfortunately, as well. And that made it a challenging time for people because of life still goes on while we're in lockdown, and people went through breakups, mental health issues, and a lot of to do. And additionally, whether that was for children or for older people, and also because people were at high risk, their health or their age or their ethnicity, and so we try and ensure that as soon as possible we did get offices so they had more family time and there was less air pollution for a while, at least in London, but also that things were worse in terms of loneliness and worries about jobs and income and how they were going to survive. But there's a very strong preponderance of people who, over 70%, thought that parks and green spaces had been a positive impact for both their physical and mental health. This chart was run about parks more generally in London, and I'll pass over in the terms of space, but we will provide the slides. But actually, people came to the park so that they could get some fresh air, and they could get out of the house, and they could do some exercise. And that looking at the age groups, actually for young people, they had the greatest impact on their mental health during the period. And part of that was the fact that they were sharing homes and sometimes in 3-generation households. So we worked to make sure that people got to use the park, and there was a greater use of parks by households within the period. Interestingly, we found that people showed that they intended to use parks more often when they come out of lockdown, which must be a positive thing for all of us. So my takeaway messages, and I've gone through quite quickly, is parks have been great for people during COVID. During the crisis, there's been a benefit for people's mental and physical health. And the final point is that people intend to use their parks more after the crisis, which is a positive message, I think, for all of us who run parks and provide them for the benefit of the public and the people who live locally. Thank you for listening.
Thank you, Mark. And it's really wonderful to see this emerging new research that really fits so well with our anecdotal understanding of what's been going on. Fantastic to actually see some of the results. I'd like to move on quickly now to introduce Carol Ritchie. Carol Ritchie is the Executive Director of the Europark Federation, and she's going to dive into a little bit more around some of the best practices that she's taken from her experience in implementing a healthy parks, healthy people approach in Europe. So welcome to Carol.
Well, good evening, good afternoon, good morning, wherever you are. Just give me a moment just to get the share screen started. Can I just confirm that you can see my slides?
Yes.
You can wave, yes, thank you very much. Well, yes, I'm going to take you a wee, and again, it's a bit of a Scottish takeover here, so I'm afraid it's another Scottish accent, and if I were to speak as fast as I need to get through this in 10 minutes, then I do fear I would lose many of you, but I will do my best as far as I possibly can. But with Europark, you always get a bit of a bargain, and tonight we're going to give you a trialogue. I'm going to share my presentation with two of my colleagues, Pete Rockcliffe, also here in Scotland from Nature Scot, and he is also the chair of Europark's Healthy Parks, Healthy People Europe Commission. And we'll be going up to the far north to Liisa-Kaijala in Parks and Wildlife Finland, because we hope to bring you this evening a bit of a European, a national and a parks perspective on what we're doing across Europe to deliver a healthy parks and a healthy people. But very quickly, I wanted to just introduce you to Europark Federation and why are we working in this sector. To those of you who I haven't met before, hello, I'm glad to meet you even in this virtual setting. Because Europark is the network of parks and protected areas of Europe. We have hundreds of members in about 40 countries. And this is what we do. We support parks, we promote sustainability, but fundamentally we bring people together. Networking across our many cultures, our languages and countries, it's in our DNA. And working in partnership with sectors outside the park boundary is crucial to our work. We bring our people together to share best practice, to innovate new ideas and tools, of course, to promote sustainability, to support our parks, but fundamentally to protect our nature. The work of Europark reflects very much the work that's happening in parks. And of course, we need to lobby and advocate for the work of parks at a political level, both at European and at national levels. As I said, we bring members together to create tools and programmes that are made by members for members to address the challenges that parks are facing. We work with the tourism sector and sustainable tourism, and of course are working in a continent with many, many political boundaries. Our transboundary park programme is also very important to us. I was glad to hear that Parks Victoria have an excellent junior ranger programme. Maybe we could set up a little exchange going. We have about 5,000 junior rangers across our network. And in the last few years, we've been developing a Youth Plus programme, because the thing about junior rangers is they tend to grow up and it's rather unfortunate. So we've created a new programme for our young adults. And it's through them that we recently launched our Youth Manifesto. And our Youth Manifesto is really a call to action to politicians at every level to ensure that youth are included in the decision-making processes. As I said, working with other sectors is really important to us. And here's just a very short example of working with the outdoor sports sector to create good principles for their activities in our parks. And that's really where we have the interface with the health sector too. This year, every year we celebrate the European Day of Parks with activities all over Europe. This year we did the whole thing online with very much a health focus. And of course, I'll bring you up to date with what we're doing in Healthy Parks, Healthy People. And we do all of that through participation, networking and capacity building, as I said, by members, for members. That brings us right up to date in terms of what we're here to talk to you about tonight. Our Healthy Parks, Healthy People programme that, although we've been working in this field for well over 10 years, we launched this programme just this year, because we are about bringing the theory into practice, about the policy into practice. And it took me back when I was thinking about this to a certain conference in Melbourne 10 years ago. So we've gone full circle and we signed the Melbourne communique. And we, as Gil reminded us, we moved from talking to action, to doing things. So we really embraced that vision from that communique about that sustainable future of humankind that depends on a caring partnership with nature. And we really wanted to help our park staff be the gatekeepers to a healthier and happier society through working with a Healthy Parks, Healthy People programme. So I'm going to hand over to my colleague, Pete. Thank you very much, Pete. I'll move you on.
Okay, thanks, Carol, and hello, everyone. It's kind of exciting, isn't it? HPHP is not a new concept, but it's more relevant than ever. And it's an essential element of what we're calling the green recovery that we need across Europe. As we've heard from various speakers, the pandemic has not only focused attention on public health, but also on the interconnected challenges we now face. The call for health in all policies also needs to be matched by the call for biodiversity and climate change in all policies. HPHP Europe seeks to do this in practice. This slide sort of summarizes the contribution that parks and protected areas in Europe can play. They're a diverse bunch, but collectively they provide a key health promoting asset for Europe. Some of them are living working landscapes with significant populations within their boundaries. Some are on the doorstep of some of Europe's largest urban areas. And as we've seen in Scotland and many other parts of Europe this year, this clearly brings a unique set of challenges around visitor management, which need to be addressed. But it also provides tremendous opportunities to contribute to health outcomes and reducing health inequalities through connecting people with nature. And for many of these long-standing parks, in particular, health objectives are a natural extension of their traditional role for public understanding, for promoting enjoyment and sustainable use of nature. And many are really already contributing to this agenda in an exciting way. There are of course challenges to be overcome in terms of relevance, understanding, funding and partnership working with the health sector. But we think these are all surmountable and there's tremendous potential in the network that we have. If we can move on, Carol. As Carol has said, HPHP has been around for many years and we're grateful for colleagues around the globe for being able to draw on their experiences and expertise in developing our European programme. Our vision is very simple. It's for happier and healthier people, more connected to nature-rich parks and protected areas. And the programme consists of 4 pillars to implement the strategy: making the case at various levels, building partnerships across sectors, developing capacity and practice within our sector, and connecting more people and nature. And we've already heard today the calls around equity and tackling health inequalities, which must lie at the heart of this. Next slide, please, Carol. Critical to the success of this programme will be engaging our parks and protected areas in the practical delivery of green health activity. Here we've listed some of the outputs which we're presently working on, which we think can best contribute to this, ranging from advice, support and capacity building through to developing partnerships and projects needed to shape future policy and practice. Next slide, please. We're not starting with a blank piece of paper though, and there's a range of good practice in place. At the national level, we see European countries and regions that are developing more integrated approaches to nature and health policy. Bang a drum for Scotland here, of course, but also there are examples from Finland, which we'll hear about in a minute, and also places such as Barcelona, which have very different challenges to some of ours in Scotland. I think we've already heard today about what do they have in common. These national approaches, leadership, advocacy, a long-term commitment to partnership working. If they were easy, they would have happened by now. Engagement with multiple sectors. We've talked about some of these already. Health, certainly. Education, yes. Transport, yes. Social care, yes. Housing, etc. And clearly the involvement of what we call the third sector is vital too. And I think the other point to note is the inclusive approach that we need. Last 2 slides from me, and then I'll hand over. We have a range of case studies in Europe. These 2 are from Scotland, but they're here mainly to illustrate the range of work that's taking place from the peri-urban post-industrial landscapes of central Scotland through to the remote highlands and islands. So this agenda is relevant across all our protected areas. And then finally, final slide, putting all this experience together, we have identified the key elements in delivering health outcomes, and these are listed here. All are important, but perhaps the added value we want from HPHP Europe is in terms of the last 4. Outreach to new audiences with a particular focus on health inequalities, truly nature for all. Partnership with the health sector, which are challenging, difficult. The establishment of green exercise projects for sustained health outcomes for specific groups. And finally, the challenge of monitoring and evaluation, so we can develop the magic numbers to build the case. So I'm now going to hand over to Lisa from Finland, just to give you a bit of practical experience from their work. Thank you.
Great. Okay, and time is almost over. So really briefly, the idea was to give from this northeastern corner of Europe some practical highlights what we've done to implement Healthy Parks, Healthy People Finland. We have this national strategy, and crucial is that it's being implemented together with partners. The aim is, as we have already heard, to inspire people to move and stay in nature more often and for longer periods of time, so that we get these health benefits to them, delivered to people visiting the nature. The key element is projects. They are so important in implementing Healthy Parks, Healthy People. And just to highlight the first theme there that has been lifted up as very important, we have had many projects on encouraging and empowering everyone to go outdoors with emphasis on equal access. Then there are other themes as well, and you can see that there have been plenty, but please, let's move on. In terms of other actions taken to implement the program, we have developed health benefit questions that have been integrated into our visitor monitoring system, national visitor monitoring system, into the visitor surveys, so that we get these figures. How do people perceive the health benefits from visits to the parks and other protected areas? We also aim at measuring when we do specific health interventions or activity programs, we aim at having measurements there too. The challenge is that often project funding instruments are such that when they encourage us to do activities, they don't allow us to fund measurements at the same time, the same project instruments, funding instruments. And finally, most importantly, I absolutely want to emphasize that how to encourage and implement a Healthy Parks, Healthy People strategy, we have to communicate to our current and potential visitors why go out to nature, how even a really short visit to nature really makes a difference. So for instance, in our nationalparks.fi, we have gathered this information. What good does it do to you to dip in just for 5 minutes? Already you get into better mood. And some challenges related to implementing the program. We have encountered that since we implement lots with projects, the continuity is a challenge, both in getting the staff into the subject matter trained well enough, as well as keeping the well-established partnerships alive. We need commitment at all the agency levels. Thank you very much for your time and attention.
Cool.
Thank you so much, Carol and team. Really great to see Healthy Parks, Healthy People expanding in Europe. I've been watching the chat and I see that quite a few questions have been posed and many of them have been answered in the chat. I'd like to just pose a couple of questions that have coming to my mind to the panelists to round out our discussion a little bit, if that's okay. I have one to Carol and team to start with, and then Gil, I'm going to pose a different one to you that I saw earlier on in the chat, but may not be one that you're necessarily expecting. So Carol and team, we're really seeing, I think, based on some of what you're describing, that this broader recognition of the relationship between health and well-being and nature. Do you think that we might be at a bit of a turning point in global awareness of this issue? And how do you see this as necessary for the future of parks and protected areas?
Well, I'll jump in first, and I'm sure Pete and Lisa will have something to add. Yes, I do think this is a turning point. I think it's a turning point because many individuals have reached a turning point. So I think you know, that generates a critical mass. But I think the most important thing that we in the parks community need to remember is never to be complacent and think that the case has been made and the argument has been won. In fact, if anything, although it is a tipping point, and I feel much more optimistic that you know, the evidence base upon which we can make arguments going forward for investment in our parks and investment in our people, you know, to create those healthier, happier, that healthier, happy society that we're looking for, you know, we have much more of an evidence base to do that. But I think we also have challenges because, for example, I think Mark gave some perfect examples there too. We were seeing, in some cases, more than 68% plus increase of visitation in many of the parks across Europe. And that were many different and new people coming into these nature areas. And the impacts that they were bringing have created a whole set of issues and challenges that parks are now having to revisit. So it's not all positive, but I think the fact that it's there is challenging and gives us impetus to move forward at a political level to continue to make the case. But I think bringing these practical examples of how we can make it work on the ground, I think is what will help us deliver that. So yes, I do absolutely think this is a time for optimism and a time to take that challenge forward.
Great, thank you. Thanks, Carol. Kind of a related question, and I did see earlier in the chat from Jessica R, and I'm going to throw this one to Gil. I think it's become very, very clear that there's all these benefits for people from exposure to nature, and that access is wonderful for our health and well-being. At the same time, there's a bit of a question around reciprocity, and you've touched on it a bit, Carol, in that this can lead to greater support for our parks. Do we have a responsibility to ensure that reciprocity exists? And Gil, would you be able to give some commentary from your perspective on whether, and we do tend to see that greater support or action for nature as a result of these broader benefits conferred to people through that exposure? Any commentary on that question from Jessica?
Yes, I think that there's a great opportunity because with COVID, all of a sudden people realize that parks are almost synonymous to public health. But I mean, everybody assumed that it was good for physical health if people walked or did any activity. But it was not as clearly accepted that it was good also for mental health, for emotional health. So that is absolutely critical, and it's also very, very important. But nevertheless, people are talking about it, but very, very few are doing. So we need all people that are in the parks movement, in the nature for all, we need to be very loud and very clear that we need investment, because traditionally in economic crisis, and there will be an economic crisis, there is a lot of money for very few activities and nothing for most. So we need to make sure that the parks and nature are in the file of the few with lots of money. Because this is not just about parks because they look beautiful or nature, it's because this is good for mental and physical health. This is good for climate change. It's good for economic development. It's good for recreation. It's good for happiness. And also we gotta put the lens of equity, because we see almost all over the world, when you fly over cities, it's easy to see where the rich people live and the poor people live, because where the rich, there's lots of trees and lots of parks. With the poor people, there are very, very few. So we gotta make an emphasis to do that. And also when we're thinking that the world's population is gonna double in the next 40 years, we need to make sure that we leave the spaces for the parks. This has to be absolutely necessary, because afterwards it's going to be very, very difficult. So the same way that we have standards for roads and other things, we got to have standards for parks. But I want to also make the emphasis of the uses and the activity. We need to have programs. If we don't have programs, people don't use it. People say, oh, I see people walking. Yeah, you see the few that are walking. You don't see the many that are not. For example, older adults, people over 60 in the US are 20% of the population, but are only 4% of the park users. Why? Because there is nothing for them to do. There are no activities, there are no programs. So we need to invest in the hardware, but also in the software. It's not just about doing walking path, it's also about doing walking groups, because that is also good for loneliness, for sociability, and that is also very important. Let's keep in mind that the older adults, every single day in the US, 10,000 people turn 65. And this is, people are living longer everywhere, in the poor countries, in the rich countries, because people tend to think it's only Japan and Switzerland. No, they are the ones that are increasing more the difference between the proportion of old people and young people. But all over the world, every single country in the world has doubled the life expectancy in the last 200 years. In every single country, people are living much, much more. And these can be magnificent activities around parks and nature. Imagine these people that have the time and have knowledge and experience. So I think we got to make that link. And this is something that we need to engage everybody, regardless of their race, the ethnicity, the gender, or any other circumstance.
Thanks, Gil. It's wonderful to hear your passion. And certainly, Claire, I'm going to pose maybe a follow-up question to you on this one. Obviously, we are at that critical moment, and we here speaking on this call can understand the critical importance of action on parks and protected areas. But how do we cut through the noise? How do we make our voices loud enough? How do we reach the health sector, the development sector, the private sector, and get through those other priorities that are currently on the agenda? Would you be in a position to share some of your thoughts on that? And then I'm going to move to the formal closing of the session and hope that we may be able, if anyone's able, to continue on after. But we only have a couple minutes left. So Claire, if you have any comments?
Yeah, thanks for a great question, Karen. If we look out at this decade, it's the decade of action for the SDGs, and it's the decade for climate action. That's very much on the top of agendas for companies that don't want to lose out in the marketplace long term, and governments know their feet will be held to the fire to see how they're delivering. So when we need to cut through the noise, we shouldn't just think in this very short term crisis around COVID. Think how governments and companies need to be branding themselves in the marketplace, anticipating how people's demands are changing very, very fast, and play smart. What are the arguments that are relevant to people who look at the bottom line of their company or government? And then you come straight back to which investments will give a return. Where will you get win-wins? You know, investments in dealing with urban heat are going to make you have safer and more attractive cities for inward investment across the world, because most of that investment is going to be going into global south cities, and they have the chance, as they did with mobile telephony, to leapfrog some of the mistakes and patterns of social and spatial injustice that have been such an eyesore in many parts of the world. So I think there are leaders with opener ears that are more ready to listen to that, and actually don't, in my experience, and I'll be very direct, don't lead with conservation and biodiversity. And I speak with somebody with 30 odd years of dedication and passion to that. Lead with what will allow societies to flourish, including economically, and it can work.
Thanks, Claire. I think that's a great concluding message for the formal part of our discussion today. And thank you so much to all of our panelists. As I said, if we can, we'll continue afterwards, but I would like to briefly invite Mariana Ferreira to say a few words. She's been listening in and drawing some threads across our conversation. Mariana is the co-chair of the IUCN WCPA Task Force on COVID-19 and Protected Areas, and also the head of science at WWF in Brazil. She's going to just briefly summarize a few of the key messages and outcomes of our discussion. And then if Rashirs allows it, we can continue a little bit afterwards. Mariana.
Thank you, Karen. Thank you, everybody. Thanks, Karen and Joe, for inviting me to be here. I learned a lot today, and I tried to write some of the highlights of the amazing presentations that we had today. So I'll be reading over my notes. And I think that Claire just started us talking about how COVID is a threat multiplier that pushes us to go through the roots and consequences of inequities, with major impacts on the youngest and on the oldest. I think one of the challenges that she posed for everybody and for the next presenters was to think on how to keep the focus and pressure on political decisions and investments to actually reduce inequalities on access to green spaces. Claire, one of the images, or some of the images you and Gil showed were actually from Brazil, from Sao Paulo, the places that I live. And we can see these very close to home, unfortunately. And Gil gave a very rhythmos presentation and took us to focus in the future challenge of the cities, and asked us if we're having parks or parking lots, if our children are actually having parks or parking lots, and that new cities should be better on including health, equity, sustainability into their plannings. So he proposed 4 calls, right? One, that we should be looking for parks for all people, nature everywhere. So we should be able to reach and a park in a 10-minute walk by 2030, great idea, Gil, and that we should focus on vulnerables and that we must change. But we need, of course, a shared vision and lots of action to actually achieve changing. And Shauna Jones listed all the positive and negative impacts of having more or less access to parks and to nature, and showed some results of Parks Victoria on how small investments in parks have a direct impact in avoiding or reducing healthcare costs. And she mentioned how health and well-being policies should actually be mainstreamed into all sectors. And what we need, of course, is advocacy, innovation, and new initiatives, and change and adapt and be resilient as we try new things. And one interesting that you mentioned is how COVID in isolation and lockdown regulations needed to be adapted so that everybody could access a park, and sometimes within their 5-kilometer radius, they couldn't reach a park. And we should be focused on urban people, children, families, seniors, and traditional people. Mark gave us an in-depth look at Queen Elizabeth Olympic Park and how visitation and even employees' life were impacted by COVID. And he concluded with 3 major remarks, that parks have been important to help people struggle through lockdown. I always say that by living in a house with some green space, I am healthy through all the pandemic, and benefits to mental and physical health, and the increase in the intent to use parks after COVID. Here in São Paulo, our major park, urban park, is still closed on weekends, and people actually gather around the park in the green spaces around the park because they really need to be close to nature. Carol, Pete, and Lisa presented the experience of the helping people have parks in Europe, specifically on Finland and Scotland, and their 4 pillars on making the case, building partnerships, connecting people and nature, and developing capacity. Mentioned that she thinks that we reach a turning point, but there are also challenges that we need actually to continue. For my day here, this is part of the challenge that we are trying, COVID and Protected Areas Task Force, and insights on COVID impacts to parks and to protected areas, on how parks, park managers, park employers, and messages to really influence high-level decision-making. I think that in terms of next year, it will be an important exponent. So we'll have the World Conservation Congress in an online adapted presentational level analysis that we need to influence and to mainstream the value and importance of protected area and conserved areas to rebuild better. But at the same time, to avoid setbacks and decisions that actually is part of the rebuilding process at these parks, and actually that we can have diverse and more sustainable funding for parks that go beyond tourism, and they are being severely impacted in Africa, for instance. So if you're up for this challenge and want to support and be part of the task force, look for the website on the IUCN WCPH page, and I'll be happy to talk to you in the future. Thank you, Karen.
Thank you, Mariana, and thank you to all our presenters today for sharing the knowledge and their understanding of best practices with us. And thank you to all our participants. We've had great engagement with hundreds of people watching this event and being very active in the chat as well. As Mariana said, I'd like to invite you all to visit the IUCN WCPA web pages. There's a link in the chat for the People in Parks page, and the COVID-19 task force page would also be there. And please continue on to visit the Vital Sites webpage to learn about this series and for information about new sessions, which will continue to be added to the program. That concludes the formal portion of our webinar this afternoon, tonight, tomorrow morning. I'd certainly like to thank everyone for being involved. I'm not sure whether it's possible, but some of the panelists have been indicating that they're welcome to stay, that they would be happy to stay on the call. If some of the participants would like to continue on, we can pose a few more questions and have a bit more of a discussion. I'll ask for a signal from Rashir to let us know whether that's possible. But for those of you who can't stay on, stay safe, stay well, enjoy the rest of your day or evening. A few of us will certainly stay here to take a few more questions if it's possible. So we'll see how a more random informal conversation goes, but let's give it a try. I would like to pose a question to Shauna, and then perhaps we can, encourage anyone in the chat to pose specific questions to any of our panelists. Shauna, partnerships are clearly important for finding practical solutions. Who else would you suggest needs to be at the table with park decision makers to improve access to parks, and how do we bring them to the table?
Advocate back to the ministers that you serve, but we have all just joined up with some submissions into an inquiry into environmental infrastructure for growing populations. So we're actually trying to come at it from all of our perspectives and weaving in the conservation, biodiversity, climate change agenda, the population pressures, housing, some of those. Public transport is a big one that certainly from an access issue, it's been high on my agenda for a very long time. And we haven't cracked that nut in Victoria. But I would say all land managers, public transport I mentioned, urban planners, the local government authorities in concert, they're close to the ground, close to their constituencies. We don't have sufficient funding, that is probably a given. But certainly the tourism sector, somebody else has mentioned, the not-for-profit and volunteer sector. We have in Parks Victoria roughly 22,000 volunteers. Many of them are older. It is a great way for people to get involved and encourage that stewardship that we were speaking about before for protecting the environment. We're also seeing that we need to diversify that volunteer sector. And when we look at what the contribution to the workforce hours that, if you like, are stimulated by the volunteer component, they're coming from all walks of life with all backgrounds that really make a strong contribution. But it is worth doing, and I guess for those of you who are familiar with, Sir Michael Marmot, who is an Australian but resides in London, and he was the author of a, pivotal thesis, I guess you could say, in terms of the vital facts or the solid facts, the social determinants of health, and that really health is created largely outside the health sector. And I think that's a really key point to respond to, that we do need that cross-sector engagement and led by ministers, but led from a grassroots coalition as well.
Those are really great reflections, Shauna. Thank you. I'll open it up to our other panelists if anyone would like to respond. I do have a question for Mark, but I think he's left. But if anyone else would like to comment on what Shauna has just put forward, we could have a little bit of a discussion, or if anyone else would like to pose a comment in the chat, we can bring that to the table too. Gil or Mariana?
Well, I would like to say from the point of view of partnerships that we need to build broad partnerships. This cannot be just about a small group of people interested in the environment. Everybody should be interested in the environment. So I think we should have, it's like a three-legged stool sometimes. One is the elected officials, another one is the public sector staff, but another one is the community, which is very broad. And when we talk about public sector staff, it's not just the departments of environment. We gotta get economic development on board, education, so that the children from grade 1 to last grade of high school and then universities are having this nature for all interwoven into almost everything that they do. We need to have, obviously, public health. We need to have a lot more people at the table. We need to have the activists. Also, the fact that now we're talking more about nature, don't for a minute think that talking automatically leads to doing. I think we're talking a lot more, which is really, really good, but I don't see that we are doing a lot. I don't see lots of investment in new parks. I don't see lots of investment in new trees. And I think we should be doing a lot more than what we are doing. I mean, just from the point of view of how the cities have been created. I mean, let's think about that. In the last 40, 50, 60 years, the cities that we've been doing, they don't have enough parks, they don't have enough trees. The sprawl is going all over. I mean, any country, take a look at Mexico, for example. In Mexico, the 100 largest cities, in the last 30 years, the population doubled, which that in itself is not good or bad. But while the population doubled, the footprint increased by 11 times. So how can you be sustainable when your footprint is increasing by 11 times? So these are the kind of things, and if we're gonna double the population living in cities, we ideally should be doing it in the existing footprint. And so the priorities are not right. One more example, because it's not about just Copenhagen and Paris and New York. No, Nairobi, I was working in Nairobi last year. In Nairobi, only 13 out of 100 trips are done by private car, 13. However, the government is investing billions to do a highway right through the middle of the city without sidewalks, without bikeways, without any tree, without parks, so how can we still in 2020 still be putting the money with the 13% of the population on something that we know is not gonna solve mobility, not even mobility, that is the focus. So I do think that I invite everyone on board that we need to do a lot more. I mean, we need to get new elected people in many places. We need to work on who elections matter. So who are the mayors? Who are the councillors? Who are the people in the boards of education? And we really need to be active everywhere. So I think the broader the umbrella, the better, and the sense of urgency, because COVID is almost children's play compared to climate change. I mean, climate change is something gigantic. COVID hopefully is teaching us that we are all interdependent. No one is safe until everyone is safe. I mean, from the head of the US government down to a person in the smallest town anywhere in the world. So that is the same effect in climate change. If we don't act collectively, then we're not gonna have solutions.
Thanks, Gil. And I think that's really important. Some really, really important points. I've been seeing in the chat, and I think it's kind of interesting, this sort of the focus on urban and more remote wild places and protected areas can be both. Are there commonalities? Are we talking about the same thing? And you know, in Canada as well, we're over 80% an urban population, as you know. And our Prime Minister recently announced that the government would be looking at investments in urban parks across the country. And at the same time that we would be expanding our protected and conserved areas network with a goal of reaching 30% by 2030. So I guess to me, I'm seeing it as very much not a either or, but a yes and both, that we need people to be able to experience and connect with nature near where they live, work, learn, and play in urban and near urban centers. We know from a lot of research that doing so means that particularly at a young age, that people will grow up with a connection to nature that leads them to become supporters of nature and parks and stewards of these places over the long term. So absolutely fundamental. And at the same time, you know, these inspirational experiences that people can have in remote, wild, protected areas are also are really vital to helping them understand the incredible value of these places on a global scale. So it's quite exciting to think about how we can have this conversation about people in parks and be relevant both to our local backyard, our neighborhood green spaces, as well as some of our most magnificent protected areas in the world. And that it's, you know, absolutely central to dealing with issues like climate change, as well as to dealing with our own human health and well-being.
I think that, Karen, you touched on a very important topic, is the urban and the rural. And I think some people also in the chat were talking about that, because it's very, very different. The reality is that the human beings, we're about 7 billion people now, and we're gonna grow up to about 9 billion. It's gonna level off, like the population growth is almost at zero now. But since there are still in many countries more children than youth, then it's gonna continue for another 40 or 50 years, but it's gonna level off, and then actually it's gonna start to decrease a little bit over the next few years. But the total population is gonna continue growing for a while, till 2050, 2060. But then it's very important, the lens of equity, because we have, you were mentioning about Canada. Yeah, in any country in the rural areas, we can be a lot more restrictive. We can have a lot more protected areas. But also we need to be a lot more flexible in the cities, because in the cities, we occupy maybe 1 or 2% of the population. And sometimes I am amazed that in many places in the cities, people know much more what makes a bird happy, or what makes this squirrel happy, than what makes people happy. People are also animals, and they are human beings, social animals. And we need, so we cannot translate exactly the same restrictions and care that we do in an isolated area that what we are doing in the city. So of course, we also need to take care of nature, but we should also care about people. So when we are doing infrastructure and we're doing environmental studies, we also should be doing, part of the environmental study should be about people happiness. And I think that when I talk about equity, it's not only the low-income countries, the emerging. For example, in Toronto, the wealthy areas of Toronto have 3 times more tree canopy than in the low-income areas. Why are we not taking care of it? And it's not an issue of money. There is tons of money. For example, in Toronto, there is a highway, elevated highway that needs repair. To fix it, it costs $500 million. Or to tear it down and do a boulevard with trees and sidewalks and bikes costs same $500 million. But then the mayor and his friends have decided to do something they call hybrid, take it down and rebuild it 100 meters. It's gonna cost $2.8 billion. So it's not only Nairobi, we're doing exactly the same horrors here in Toronto. When we have 1 out of 4 children living in poverty, when we have issues of trees, of parks, of housing. So all of us have to work, because everything is really interconnected. The issue of the race issue, Black Lives Matter, indigenous issues, people of all visible minorities, because the issue of blacks is not only an issue of blacks, it's also all ethnicities, all visible minorities. In Toronto, we have 52% visible minority, 8% are black, 44% are non-black, and everybody's discriminated. So we need to work. So all of this, I think that if we have a broader umbrella and look about the change, and we also realize and we convince, and if the elected officials are not on board, we gotta change the elected officials. We need new people, not like some people say, we need new young people. No, eliminate the young. It can be young, it can be middle-aged, it can be old, but we need new people if the ones on board are not making the change. I'm very happy that in Canada, Parks Canada have gone into cities. Parks Canada has now the largest urban park in Canada, and maybe in many places in the world. It's 22 times the size of Central Park. That is Rouge Park, almost in the heart of Toronto, less than 30 minutes from the heart of Toronto. It's an incredible park. Also, the federal government has another park that in Downsview Park, where there used to be an airport, also gigantic. Unfortunately, now it's being managed by the real estate company of the federal government, which is horrible because they have no idea about parks. So I hope they turn Downsview into Parks Canada. But everybody needs to work on these governments at all levels. We need the federal government, the provincial or state, the city, the municipalities, the neighborhoods. This is something at all levels, because each one satisfies different needs, but all of them really have to be interrelated. So I'm optimistic, but also we need to realize that this will not just happen. We cannot be politically correct and be quiet. No, we need to be respectful, but we need to be loud and clear that we need nature for all and that we are not having it at this moment.
Can I just
Thanks,
say, I
Deb.
totally agree. I can't find a way to send a comment, but absolutely, totally agree with you on all of that.
Thank you, Deborah. Thanks for your comment. Mariana, would you like to, can I turn this to you for some closing words, I guess? I think we should wrap up our conversation. I'm wondering what you think in terms of how this urban, rural, or more remote, I won't call it a divide, let's call it continuum, because to me it's really a continuum of our parks and protected areas. Does this resonate for the work that you're doing with the COVID-19 task force and with the WCPA more broadly? And how is it relevant to some of the work that you may be bringing forward? Just curious on your reflections, and then perhaps after that we'll close on. Thanks.
Yeah, definitely, Karen. As I was reading the comments on rural versus wild areas, I was remembering one pyramid that we have from a project on children and nature here in Brazil that says, like, every day children needs to go outside, even in their garden, in their houses. Once a week, they can go to an urban park on the weekends with their families. At least once a year, if they have the chance and opportunity to visit actually a wilderness area, a national park, that would be a great experience, you know. But as we look for inequalities, and right now with the COVID impact, as we know, travels will be much more restricted. People will be more afraid of traveling, or even have less funds and resources to actually travel and to distant places. I think this makes urban parks even more important at this scenario. So I do think this is a continuum. I think they're connected, as you said, and there are a lot of studies that show that if people have more connection and experience in nature everywhere, there will be much more and to vote for people that actually support nature. So here in Brazil, for instance, I receive people here in São Paulo that say, okay, I have one day, I want to see the Amazon. And I say, well, it will be impossible. It will take you 6 hours to go, and then 2 hours on a boat, then 3 hours on a road trip. You don't need all that, you know? And if you have the opportunity to actually value nature in general, once we have some setbacks and some challenges in everywhere in the world, I'm sure these people will be willing to support and change, as Guilherme was saying. So I think that there are differences in challenge, because in those more remote areas, we'll still need to engage local communities and populations sometimes. I remember once visiting a family in the Amazon that lived in the border of a huge national park here in Brazil. And they said, well, the Amazon is important, as it was something very far from them too. So we need to understand that even rural populations sometimes don't have this connection to nature. They want to be urban. So also working with them to value nature is important, not only with urban populations, but I think that this is a continuum. We need to work. And I think that in task force, in the COVID task force, we are working a lot with the urban task force too, and to make this connection happen. And I think that under the new COVID and after COVID scenario, where travel will be more restricted, resources will be more restricted, and we have more unemployment, urban parks will get even more important at this scenario. So thank you.
Fantastic points, Mariana. And I would add to that too, that urban areas are often extremely biodiverse as well, so that these are incredibly important from a biodiversity conservation perspective. But I'd just like to thank everyone once again for really dynamic presentations, for great questions from the chat, as well as to each other here. And we still have almost 50 participants on the line, so we must be saying something interesting. And thank you so much for everyone who joined today. Please, as I said earlier, share the word about the series of the Vital Sites seminars. There are several more coming up. And really, I think a great way for us all to connect online during these challenging times. Thanks again, everyone. And thank you to Rashir, who's behind all of this, and for keeping us organized today and making sure that we are actually functioning from a technical perspective. So thanks again, everyone, and bye for now.
Thank you. Thanks, Karen.